We've been dealing with COVID since this past March. There are a few questions that were specific for doctors. The first is asking about other doctors telling patients they don't have to wear a mask. I believe that the case rates for COVID and the complication rates of this virus are well documented. We are definitely in a pandemic, and significant changes are required to decrease the spread of disease, period. The best current protection we have is consistent mask wearing and social distancing, as this is well established. Any doctor who does not recommend this may be harming their patient, which would be a violation of the Hippocratic Oath. People in authority have been giving mixed messages about this virus since the beginning. This has increased the rate of infection and spread in the US, which is now one of the highest in the world. COVID is actually one of the most contagious viruses we've ever seen, and the complication rate is significantly higher than the flu. The third question has to do with social distancing guidelines and what else can people do to protect themselves. The obvious answer to this again is consistent mask wearing. Masks need to be worn whenever you're around other people. In addition to social distancing, they need to be worn properly, which includes covering both the nose and the mouth. If they're torn or ripped, they should be replaced. Any covering over the face is better than nothing. I hope you find this helpful.
With the COVID-19 pandemic, I would say my life has definitely made a huge change, both as a individual and a essential worker. I work part-time in a grocery store called Sprouts. I would say with everything going on, definitely has been a change. There definitely has been changes I've had to make to where I don't affect others and I keep myself safe because I am someone that is immune compromised. I have lupus and arthritis, and my lupus is when the immune system attacks itself, and that makes me more vulnerable to the COVID illness and anything that could potentially make me very sick, or even as some statistics say that it could even kill me. Whenever I go out, I always wear a mask. I always make sure my hands are sanitized, and I make sure that I'm respecting everyone's 6 feet apart distance, because, like I said, it's better in my case if I do. It's better for my safety as well as others' safety, so that way we don't spread it around any more than it's already being spread. As an individual, I would say it has been harder because it's been 9 months of quarantine and it doesn't seem to be getting any better. I really hope it does get better. I don't think that COVID is going to be up and gone, but I do hope that it'll subside and make it easier for us to manage and live our everyday lives once we've reached a point where there are less deaths, less cases, and less potential of those possibly being killed by the vaccine, not by the vaccine, by the disease.